I think the myth that is persisting the most in eye care right now, there's a lot of chatter around fear for presbyopia correcting eye drops, but without a lot of education or understanding of the molecules. And I think that when we do some research, when we look in retrospect, you know, are the incidence of retinal detachments or retinal tears or holes that are occurring really that much higher than the average population that this would have occurred in anyways? We're not finding that. And so I think the myth that I'm hearing is there's just a lot of fear that presbyopia correcting drops, the entire category, can cause retinal problems, and that's just not the case. And so there's a lot of safety studies and whatnot in play, but people are fearful.
A myth or misconception that I think is out there both in our patient's head and maybe even in optometrists kind of minds as well, is that, you know, from a patient perspective, they think maybe they don't need to come in and see a real life doctor every year. And from a doctor's perspective, maybe we're getting a little down on ourselves thinking, you know, there's no way I can get a contact lens wearer to come in and see me every single year when they can buy their lenses online, or, you know, kind of stretch that out a little bit. And I think in 2026, this is actually the time to really show our patients how valuable it can be to come and check in with their optometrist every year.
I think the biggest myth is that optometry is going to be replaced by AI. And that's because when you are a patient, and I deal with patients obviously, but I always see myself as a patient, the lack of human connection can never be replaced. When you go into full digital, it can't be replaced. And I have confidence in that, because at the end of the day, people want to connect with humans. Humans want other humans. So
I think the biggest myth that we have in eye care is that patients are well equipped to ask all of the questions to doctors and know what to expect from their eye exam. For us as practitioners, we want our patients to be well educated, but at the same time, our patients don't know what's out there. And so it's our job to take care of their refractive and visual needs, but also their medical needs, and uncovering things that are having impact in their lives they may not know is impacting their lives, but we can see it, we can treat it, and we can take care of it, but giving them the flexibility and the options to help explore that as well. So we kind of are this conduit to care, but our biggest myth is that our patients are going to tell us everything that's wrong, and they're just going to give us the opportunity to just say, yes, do this, or no, don't do that.